My name is Dr. Preeti Shenoy. I'm a colorectal surgeon here at Oroville Hospital in Oroville, California. I'm here to talk to you today about the things that I can offer as a colorectal surgeon here in this community. Colorectal cancer is the third most common cancer here in the United States. By some estimates, there will be 95,000 new cases of colon cancer this year and up to 35,000 new cases of rectal cancer this year. That adds up to about 1 in 20 men, 1 in 22 women. It's a very common cancer and something that we can actually do something about. Colonoscopies are a great way to not just detect early cancer, but to also pick up on polyps. And we know that most cancers come from polyps, and we know that by taking polyps out, we decrease that person's risk of developing cancer, colorectal cancer in general. What has that translated to? It means that since the 90s, when colonoscopy screening protocols are becoming more and more popular, there's been a steady decrease in the overall incidence of colorectal cancer by about 2% each year. While we know that colonoscopies are an extremely important thing that we recommend to our patients, we also know that they can be an uncomfortable thing to talk about and an uncomfortable thing to undergo. And that's why the techniques we use nowadays, whether it's talking about the bowel cleanse before or the sedation we use during, is really all focused on making it a more comfortable experience for our patients, because we appreciate what you're doing and you being there. But we also want to make sure that we do our job in helping people live longer, fuller, healthier lives. So the Da Vinci robotic system is a robotic platform that surgeons, including colorectal surgeons like myself, often use when operating. It allows us to work with 4 hands instead of 2, and it allows us to do very complex surgeries through smaller incisions, which translates to less pain, a smaller infection risk, and less time in the hospital for our patients. By using hand toggles to control multiple arms and with the magnified view of what we're operating on, it really allows the surgeon to be a lot more precise and a lot more careful and handle the tissues in a much more thoughtful way. The Da Vinci robot is a really unique tool in the fight against cancer, and we're very, very lucky and we're very happy to have it here at Oroville Hospital. I think most surgeons, before they're about to start a surgery, take a moment and make sure that everything is prepared and set up so that the surgery can go as smoothly as possible. Every so often I like to take a moment and step back and think about how this patient got from point A in my office to where they are in surgery. And it really is more than just me. There are nurses and medical providers and techs and OR staff and the people who draw their blood and the people who show the patient and their family to the room and to the waiting room. And even the patient's family. Really, all of this that we do here requires a huge group effort. And it's something that I'm very proud to say that we do very well here at Oroville Hospital in our goal to help people grow healthy together. I would say that the most important part of my job is really focusing on developing that patient-physician relationship. Our relationship starts with our first meeting, which is usually in the office. And it's more than just me, it's our entire office staff. And we all work together to make sure that each patient is treated with respect, but then also that their medical problems are addressed efficiently. I know that when I'm seeing a patient in the office or when I'm about to perform a procedure, that I'm bringing my full focus and full attention, and I understand that people coming to us as providers are giving us their full faith that we are going to take care of them and really do our best to help them feel better. And that is a responsibility and that is an honor, and being able to build that bridge and develop that trust, I would say is probably one of the most fundamental things about being a surgeon. After moving here, really excited to be a part of the Oroville community and really happy to be a part of the Oroville Hospital family. Everyone we've worked with has been fantastic. Our teams are ready and excited and growing.